I am Morgan Harrington. I am our National Manager of Programs here at American Liver Foundation. We are here today to join for the Beyond the Diagnosis Patient Journeys in Liver Health, which is part of the large liver meeting today with AASLD. We are recording today's session, and we do want to let you all know that before we get started. And this will be up on our YouTube as well at a later date, just if you want to come back and revisit the conversation. ALF's mission is to promote education, advocacy, support services, and the research for prevention, treatment, and cure of liver disease. As part of our commitment to the liver community, ALF offers a range of educational programs and resources for patients, caregivers, as well as providers. You can always find more information at liverfoundation.org. We also want to invite you all to join the American Liver Foundation Patient Registry. This patient registry is the first ever patient registry for all types of liver diseases. Our goal is to help researchers better understand liver diseases and how these diseases and current treatment options impact patient lives. The registry is open to all individuals who are 18 and older that reside within the United States with any type of liver disease at any stage, including transplant recipients. Participation is easy and includes a user-friendly online survey that takes about 15 to 30 minutes of your time. You're welcome to scan the QR link on the screen or the link to participate in the registry. We also have our new ALF Living Donor Network. This is the first national database designed to connect non-directed living donors with transplant centers across the country, a critical step in addressing the shortage of liver donors. Our goal here is twofold. We want to increase the number of living donor liver transplants in the US, as well as eliminate the pediatric liver candidate waitlist. We would appreciate if all of you would just check this website out and share within your network. I am ecstatic to share our panel with you all today. We have Kimberley Johnson with us today, who is a licensed clinical social worker at Penn Medicine Transplant Institute. She currently provides comprehensive emotional and social support to transplant patients as well as their families. She previously worked in palliative care and earned the 2022 Penn Medicine Experience Advocacy Award before transitioning to the Transplant Institute. We are so glad that you are with us here today, Kimberley.
Thank you so much, Morgan. It's a pleasure to be here.
We have Barb with us, who is one of our incredible ALF patient advocates. She has traveled to all 7 continents and 53 countries. She is passionate about cooking and enjoys making crafts in her spare time. We will hear more about Barb's story coming up shortly. We also have Daryl, who is another incredible ALF patient advocate. Daryl is a veteran and an avid gardener who has ridden his motorcycle across the country. He has also participated in past Transplant Games of America and will be participating again in 2026 out in Denver. I cannot thank the 3 of you enough for joining us today. We are excited that you are here. We are looking forward to hearing more of your story. So to sort of give an outline of how today will look, we are going to go ahead and we will have Barb and Daryl start sharing little bits of their stories. We will have some input from Kimberly, and we would love for you all to continue the conversation, within the chat. If there are questions that you have, please leave them there. We will be monitoring to make sure that we capture any questions that may be coming up. And we will also have some time at the end of today's session to open the floor for other people to share more of their journey. So Barb, I would love to start with you. I would love if you'd be able to share a little bit about the beginning of your story. Where does your journey start?
Okay. Hi, everybody. It's nice to see some faces and names that I know from different groups I'm on in the ALF. I had a problem itching in 1999, and I would scratch my hands and my feet until I bled. It was really a mess. And my primary care doctor said, I think there's something wrong with your liver or kidneys. And so I went to a gastro who then determined it was my liver. I am one of those crazy abnormal people. I mean, I rarely drank. I've never done anything that could have possibly caused me a liver disease, but leave it to me to get it. My mother always told me to be different. I don't think this is what she meant. But I was diagnosed then in 1999 with an unknown liver disease. It's very similar to PBC, but I don't have the PBC marker. So they treated it that way. I was sent to Hopkins in 2000, Johns Hopkins, because my numbers were astronomical and they didn't have MELD scoring back then. So it was a whole different ball game. Literally, no matter how sick you were, how well you were, you went to the bottom of the list. And so at Hopkins, they had told me that I had the highest numbers they had ever seen. My cholesterol was 1870. I mean, things were crazy with me. I was perfectly happy at Hopkins, and then my amazing hepatologist was offered a job at Duke that they were going to open a hepatology center if she would come. So needless to say, she went. Unfortunately, my second hep was not as good. And so I was just getting very frustrated because it had been years and years later at this point. I had just been kind of hanging on. My numbers were high. I looked healthy. I felt good. But then in 2015, I was on vacation in Florida and I woke up one morning with Buddha belly. I had ascites. I was freaking out because I knew what it was. And it was like, uh-oh, this is end stage now. And so I went to my doctor and I was miserable. And I said, I have to get drained. I'm so uncomfortable. I can barely walk. I can barely sit or lie down, or I couldn't sneeze. My lungs couldn't expand enough. And I was with a friend and he said, no, it's not time yet. And my friend was like, look at her, what are you talking about? And he said, no, I'm not going to, perform paracentesis on her at this point. So I was extremely frustrated, and it had gotten to the point where I just felt like I was the only person trying to keep myself alive. And I help out at a luncheon for seniors on Wednesdays at my church, and the head of it is a former OR nurse. And so I just started crying as soon as I saw her, and she was like, "What's wrong?" And I said, no one's trying to save my life, so I'm not going to either. I give up. I quit. I'm done. I may as well stop taking my medicines. There's no point. And she said, no, we're not doing that. We're going to get you somewhere else. And I contacted my neighbor is the head of ear, nose, throat at Georgetown. And a friend of mine since kindergarten had a transplant at Georgetown. And they both contacted her surgeon, who then was able to, I'm echoing. I hope I'm not with y'all. Who then set up, they called me the next day. This was crazy. That was a Wednesday. On Thursday, they called and said, Dr. Satoskar would love to meet you. And they said, can you come in tomorrow? And so within 3 days, I was with a different doctor, and he walked in the door and he went, oh my goodness, you must be miserable. We need to get you drained. And I was like, thank God somebody is going to try to save my life again. Which they did. I was okay for a while, but then I started getting worse and had ascites and varices and had to get those banded. I had encephalopathy.
Let's pause there, Barb. That's perfect transition. I think that'll get us to our next spot. Daryl, I'd love for you to share the opening part of your journey.
Yeah, all right. Thank you. And just as Barb said, it's nice to see everybody, some familiar faces out there. Again, good to see you. Now, my story was a little bit different. I was living life in the high lane, in the fast lane. I worked aboard cruise ships as a cruise director. I was in charge of all entertainment, all social activities. My job was to make sure you had a good time on your cruise. And I got to tell you, I was pretty good at my job. When you left my ship, you had a great time. It was something to remember. I'm also a veteran, as she mentioned earlier. And as a veteran, I go to the VA for my health checkup. So I went to the VA for a scheduled, or actually just one of those scheduled checkups. And at that scheduled checkup, they told me that I had the hepatitis C virus. Now, I didn't believe them when they told me because I wasn't sick. I didn't feel bad. Heck, I didn't even have a headache. So I just didn't believe them. And I come to find the hepatitis C is a virus that will can lay dormant in your body for years and you not have any symptoms, but it's still doing damage to your liver. And again, when they first told me about it, this was a time it seemed that they didn't know very much about hepatitis C. There wasn't a cure for hepatitis C, and there was only one treatment, which wasn't very successful and had some devastating side effects. So because of those side effects, I really didn't want to take that treatment. Some of the side effects were anxiety, mood changes, it's bad for your skin. It was a 48-week treatment. So I didn't want to do that. So I went on, and again, I wasn't feeling bad. So I think it was probably, I'm going to say, a good 7 months before I even thought about anything else. And one of my friends said, well, they made it sound pretty serious. You might want to get a second opinion. So I did get the second opinion, and I went to a community health place, and the doctor just, oh my God, yes, you've got it, and I've got to tell somebody. And so at that point, we began to look at the hepatitis C. But again, at that time, there wasn't any cure for it. So the doctors just kept monitoring me. And eventually they convinced me to try the interferon because there wasn't any other choice. Again, it's a 48-week treatment. And for about 22 weeks, my numbers were doing well. But at about week 22, my numbers began to go up again. So the doctor says, look, we're going to stop this because it's not doing any good. And basically, we'll just wait and see. But they knew that hepatitis C could also cause liver cancer, and they continued to monitor me. And just as expected, I did have liver cancer, and we cured that liver cancer.
Thank you, Daryl. That's such a great introduction to both of your stories. Kimberly, I want to come to you a little bit. In Barb's story, she shares that she felt like she wasn't being heard by her provider. And I know that that is something that lots of people have experienced in the past as well. And I'm curious, from your perspective, what are some ways that patients can truly advocate for themselves if they're in that situation where they aren't feeling heard or seen?
That's a very good question. And Barb, you did a great job in just kind of communicating with people in the community, people you knew, to kind of get where you needed to go. And we encourage our liver transplant patients who are in our support group or who we see, come into our clinics, to keep in contact with their liver transplant teams. We have coordinators, we have ourselves, the social workers, and we encourage them to keep in contact with us to tell us any symptoms, any changes. And it may be just the smallest thing that they think, but it may be something significant to the team. And even within our liver transplant support group, they encourage each other to advocate for each other, to advocate for themselves, and to always keep in contact with not only their nurse coordinator or their primary care physician, but also the hepatologist. So that's one of the ways. And let me add, there's supports that help them pre and post transplant. They're advocates. They can also help patients to advocate, on behalf of them, just to kind of keep things, just kind of going in their process, and that their team is just made aware of any changes, any concerns that either the support or the patient has.
Thank you, Kimberly. And I did want to talk a little bit about Daryl's story as well. He shared that he didn't believe he had hepatitis C. And I know that that is something that, denial is a huge stage of the beginning of these chronic illness and, even in end-stage liver disease. Can you speak a little bit about the support that maybe people should be leaning into as caregivers when they have a loved one who is experiencing, maybe a very large, heavy diagnosis, and the caregivers are struggling to encourage them to go, but as patients, oftentimes we might be a little bit more heels in the sand about seeking care when we're maybe not ready to accept kind of what we're facing.
That's another very good question. Our caregivers, we actually have caregivers who join us on our liver transplant support group twice a month, both post-transplant patients and caregivers and donors. And within our caregivers, we do encourage them to be very involved in their patients and their loved ones' care. There may be some denial in the beginning, but if caregivers are available to go, maybe with their loved one, to appointments, they can get educated, as well as, of course, the patient can get educated, which could also help them both, with just clarifying some thoughts of denial and be able to educate them on the other resources that are out there in the community that could help them both. A lot of caregivers support groups that are out there through the Gift of Life, through some other avenues that we also pass on to our patients and caregivers. So that's a very good question.
And ALF also does offer a support group for caregivers that we have put in the chat. So if anyone is unfamiliar with that, please go ahead and look in the chat for that link as well. Barb, I would love to come back to you a little bit. Before we get to the end of your story, I'd like to kind of explore the middle a little bit more, kind of where you were at from the time you transitioned over to Georgetown, but not quite to the end of your story where we know the ending. What were some of the heavier times? What were some of the better times? But we'd love to hear a little bit about all of it.
Okay. It's really difficult when you start seeing new symptoms. And I mean, I had heard about ascites, and the only time I had ever seen anything about like varices was when you'd see like Grey's Anatomy, and someone had been an alcoholic and they were throwing up blood and they couldn't get a transplant, and it's like, thankfully mine were not bleeding, but you're just like going, what is this going to be? What are these things? I mean, getting drained the first time, getting paracentesis. When I say getting drained, they literally put a needle in your belly and you watch your belly go like this throughout the time that they're pulling fluid out. It's like, oh my God, I have feet again. They do that so you're comfortable again, but unfortunately it comes right back. So I was dealing with those things. I would notice I couldn't remember things and just names. And I would drive myself crazy lying in bed going, what was that singer's name? And I could name all the songs. I just couldn't name the person. And, so you go through these things. I was incredibly lucky that I had my two best friends who just were with me throughout the whole thing. My best friend had actually moved into my house when I had my transplant then to take care of me for 2 months. I've never married. I don't have kids, so I had no one else to fall back on. But all of my neighbors, I'm very lucky to live in an incredible neighborhood, and all of them were behind me. All of my friends from my church, just, people who knew me knew I was having a hard time. And so they were there to do whatever I needed. I'm one of those people. I don't go through like the 5 stages of grief. I get mad and then I just accept it because there's no point in doing all the rest. And so I had accepted early on that this was going to be weird, and was always saying, I'm going to need a transplant someday. And you just kind of hoped that day never came. But for most of us, it does. And then it's a good thing because you feel so miserable. And kind of like what Daryl was saying, for me, the best thing that ever happened to me through this whole thing was I got liver cancer. And like I say, my MELD score was nothing. It was like 12. I shouldn't have even been listed. But because I had so many complications, that was why they listed me at both hospitals. Well, at the first hospital would have definitely, but at Georgetown, they knew I couldn't keep going the way I was. And it's hard. I was a backup recipient 17 times. And the first time you go in, it just messes with your mind. And so you need people, you need your support group. Do not ever try to shut out friends and stuff. Let people know what's going on with you so that they are there for you when you are having these terrible, terrible times. And you can get on the support groups. If you're not on at your hospital, a support group, get on it. We have a great one at Georgetown. We also have the ALF one. And I've helped 5 people prepare for transplants that I've met through that. But you want to let everybody know what's going on. Don't be ashamed of it. It's not the days back when you'd go, she has cancer. You wouldn't even say the word out loud. It's something that happens. I looked the same as I do now. I looked healthy. Nobody would have ever known there was something wrong with me, except I kept gaining weight from having so much ascites. But like I say, cancer is what moved me way up the list. It made my MELD score go up to getting a transplant. And then you have to be free and clear of cancer for 6 months. And it was like 6 months and like 3 days or something that I ended up getting the transplant then. So just don't give up. I mean, I also did really stupid, if I can real quickly say, I did stupid little things all around my house, little signs that would keep me going, that were just words of encouragement. You know, when you get to the end of your rope, don't, you know, tie a knot and hang on, and stuff like that. Religious things, whatever works for you. But I read them every time I walked past them. They were in every single room, on my walls and my mirrors, and that kind of thing helped. Every time I walk out my door, there are still 2 signs that say, don't give up, never give up, and I am strong. I can get through anything. Do what you need to do to keep yourself psyched up.
That is such great advice, Barb. And I think so many of us could utilize that just in our regular day-to-day. But such an important reminder when you really are in those hard, challenging times, and it can feel difficult to take the next step forward. Daryl, I know your story well, and I know your story is somewhat different than Barb's. And I would love for you to highlight some of those differences while also talking a little bit about the challenges that you met in the middle before we get to the end of your story.
You know, I think the biggest challenge for me was because there are no symptoms for hepatitis C. And you know, it can go on for quite some time. That's exactly what happened to me. I didn't have any symptoms. I wasn't feeling bad. And we're talking about for probably some years. It was 2001 when I was diagnosed with hepatitis C, but I didn't actually feel the effects of 2000 of the hepatitis C until around 2008, maybe 2009. But in the process, there were things that were happening to me that I later found out was a result of having the hepatitis C. Barb mentioned itching. I itch like crazy, but it wasn't enough that it just stood out to anybody else, or really stood out to me. Just I was just itching all the time. I'm scratching all the time. One of the other problems I had was I had constant cramps in my body, cramps in my legs. Well, at the time, I was living in South Florida. And so my friend lived across the street from me, was a pro football player. His word was, well, Daryl, you got to hydrate. We're in South Florida. It's hot. You got to hydrate, got to hydrate. So I would set my clock for daylight or early in the morning and get up first thing in the morning and work in my yard, because that's what I love to do, working with my flowers. And when the pool would turn on, that would be my cue. Okay, it's time to stop now. And I still have these cramps, and I didn't know where these cramps were coming from. And so it was things like that that really got me. And when I really started to feel, you know, you mentioned the ascites. The ascites, for me, it's a funny story, because just like you, my stomach started to fill up with this fluid. And again, I don't know what's going on here. What is happening here? So I go to the emergency room, and the emergency room, they take 3 liters of fluid from me. And I'm losing my mind. Oh my God, I had 3 liters of fluid here. What am I supposed to do with this? And then a couple of weeks later, I've got to go back again. But in the meantime, someone from the VA said to me, don't go to the civilian emergency room, because they can only take 3 liters. Go to the VA hospital and they will take all that you need taken off. Well, I get to the VA hospital, they take 8 liters of fluid from me, and now I'm really going nuts. Oh my God. And as time went on, you know, that became more and more frequent. I really kind of freaked out when I had to stop driving. I'm a shopaholic. I'll challenge anybody to a day of shopping. And my biggest mall is maybe an hour and a half from where I live. So I go to the mall one day, and I run around. I'm talking to people that I know and stuff. And I get ready to come home, and I realize, oh my God, I can't drive home. And so I had to sit and go through myself mentally the process of, okay, let's just get to this point. And when we get to that point, we'll stop and rest. And then we'll get to that point. So I had 3 stops, and I got through those 3 stops, but that was my cue. I can't drive anymore. This was in August that happened with me, and I finally ended up getting a transplant in January. So through that time, not being able to drive was something that was very difficult for me. So again, I think it was just the fact that because those symptoms didn't kick in, and I knew what was happening, things were happening that I didn't know what was happening. I later found out it was happening because of. And not knowing, I really didn't know what questions to ask or who to ask. And, because again, my disease was kind of new to my team, we were kind of just walking through it and going through it together. And so that was the really big challenge. But I want to, something you said earlier is that you can't go through this by yourself. Barb, you're absolutely right. You think that, oh, I can handle this. I remember my doctor said, you got to have a support system. And I said, oh yeah, I've got some friends. If I need to go to the doctor, somebody give me a ride to the doctor. Somebody pick up medicine for me. She goes, no, that's not what I'm talking about. You're gonna need a support system. There are gonna be some days that you won't be able to feed yourself. There are going to be some days that you won't be able to dress yourself. And there are going to be some days that you just need somebody. And that support system started for me actually before I got to the point of transplant. I have a cousin that lived 2 hours from me. And every Saturday, I knew he was going to show up. I knew he was going to be there. And some days we might go out for lunch. There were some Saturdays he would show up. I couldn't go any further than my chair, just sitting in the big chair. And we talked. I'd nod out for a minute. We talked. I'd nod out. And then there were some days when I was just out and he was there. But I knew on Saturday he was going to be there.
That's such a beautiful comfort, Daryl, to have that consistency behind there. You both talk about the importance of support. And Kimberly, I want to come to you a little bit to talk about the stigma that oftentimes is associated with liver disease. And Barb and Daryl have both shared how support was really important for them. But not everyone feels comfortable reaching out for that support because of the stigma that is so oftentimes associated, especially historically, with liver disease. Of course, we know now there's more than 100 types of liver disease, and the majority are by no fault of anyone's own. And even ones that previously were thought of as a fault are no longer considered that. We know that all liver disease stems from an illness. How do you encourage patients that come to you to really combat that stigma and be able to build that support system that, as we've heard, is so there out of necessity?
We encourage patients to educate themselves, of course, educate their supports, and it helps them to be able to present their story, maybe even to potential donors, talk to their family and their supports about what care they're going to need from them and why they need their care. So, being able to help educate our patients on how difficult it is to kind of tell their story and to get them over that fear of the stigma. Some patients, a lot of patients come to us with, like you said, various liver diseases. So we try to do an individual discussion, of course, with all patients to try to help encourage them to get over that stigma and be able to talk to their supports. We tell them the same, Daryl. They can't do this alone. This is such a major, major surgery and a major procedure in their life. And they're not able to do things, especially in that 3-month recovery period. They have to have supports there to help them with, bathing, help them with cooking, help them get groceries, just even help them to, again, keep in contact with their families, but also with their support teams. So making patients aware that, the stigma, it's out there, but we can help you overcome that. And we keep in contact with them, the social workers, to provide some counseling. And we even see our patients sometimes when they come into clinic to check in with them to make sure that they're doing well emotionally. And again, even try to help them with how they would present, with talking to family about their condition. That helps them get through, thinking about that stigma and moving forward to get even endorsing supports to help them post-transplant.
One other thing I want to address, both Daryl and Barb have discussed the trials in this period, right? Where you've been diagnosed, in Barb's case, she wasn't feeling super great initially, but she had several months, prior to ascites showing up in her story. Daryl shares something similar. I didn't know that these were associated symptoms. We know now that palliative care is oftentimes offered very early on in diagnosis to help that bridge. How do you encourage patients who maybe hear palliative care and think, oh, that's end of life, I don't want to go near that? How can we help patients kind of moving forward with liver disease reframe that to think palliative care is a bridge? Palliative care can be a really great step for strength. What does that conversation look like in your clinic?
That conversation to patients and caregivers look like a team of specialists who can help with the symptoms that they're going through currently. A lot of patients, like you said, think once they hear palliative care, they think it's end of life, kind of get, versus hospice care, but we clarify that, the hospice care services, like I said, are specialists and they help patients with what they're currently going through, any chronic health conditions. So, we educate our patients, we educate our caregivers on what the benefits of palliative care is and how it can help patients manage from this point forward. So it's a delicate conversation. It's a necessary conversation.
Yes, I can imagine that that's not an easy one to have with patients or their families. Barb, I want to come back to you to hear how your story brings us to today. Where have you been in the last several years before your transplant until sitting here with all of us now?
Okay. So yeah, now it's all, rainbows and sunshine. So, I had a really rough time the last 5 years before my transplant. And that's when I was just sick a lot. Of course, it was the opposite. It's like all of my blood work numbers were so low. It was crazy. I shouldn't have been listed, like I said, but yet I was so, so sick. And so my doctor, talk with your doctor too, if you feel like something has to happen, because I can't keep going like this. I mean, they were treating all of my symptoms, my bad things I was going through. But I was like, I'm never going to get the transplant. I'm going to keep going through this. And oh my gosh, when Daryl said about the cramps, I had cramps that I thought would kill me. My first one happened when I was in Florida again. But it was constant. And for me, they were all inner thigh cramps, which isn't like a Charlie horse and you just step on your foot and everything goes away. You can't stretch these out. And I would be crying and screaming and just such a mess. And I had pills I could take. I'd get a heating pad. I'd drink Gatorade. I was just, doing anything I could to make the cramps go away, which was insane because I was so overweight. It was ridiculous. I lost 100 pounds after my transplant. I had so much fluid in my body. So I'm like, I don't know why my body thought I didn't have any fluid in it. But, thankfully they did all the backups. And then I actually went in as primary one time and there was a problem with the donor liver. So I had to come home. But then a couple of weeks later, I got the call and it was the best, most terrifying day of my life. There is no other way to describe it. I had a whole email chain set up so I could just type in something then that was saying, I'm on my way to the hospital, I should be getting it. And my best friend is going to contact you until I'm able to again. And that was really helpful too, because then not only did I have, my two closest friends that were helping me, but I was getting texts and emails from up to, 30 people a day just saying, you can do this. And my kidneys were terrible. And they were all like, go kidneys, go kidneys. We had chants going. So I was fortunate enough. I did get my transplant on July 8th through 9th. It started at night and went through the morning of 2021. And just like everybody's been saying about just when you first get home, it's brutal. You have to have help, and it has to be somebody that you're perfectly fine with being naked around, because it's the kind of thing where my best friend was trying to give me a shower, and it's the greatest feeling in the world to finally get a shower. It had been 17 days, but still it's like, are you comfortable with this person? So and I had 26 meds lined up on my dining room table, numbered and lined up so we could get them, for me taking every day. Now I'm down to like 6, and some of those are vitamins. So big whoop. I take truly one thing for my transplant, my anti-rejection meds, my tacrolimus. But it's tough. I actually had to have a follow-up surgery the next year, a hepaticojejunostomy, which is a bile duct resection. My bile duct and the donor duct just didn't match up, and they kept trying to repair it and finally said, we got to do surgery. And once they did that, everything was great. Any problems I had went away. And now I feel terrific. My kidneys aren't real happy. That's one of the big problems with liver disease is a lot of people, it destroys your kidneys. And so, waiting possibly for a kidney transplant, fingers crossed I don't need one. But, that is something else you should know about, that's a possibility. But everyone I know has had other things. I have MS, I have diabetes, a lot of us have some other kind of disease that it makes sense that we ended up with a liver disease. So just take care of yourselves. That's the biggest thing. I mean, now I feel great. I just can't believe I feel the way I do now. So, get yourself to that point where you can feel good and get the help, talk to people, take classes, get physical therapy, do whatever you need, but get yourself back to feeling good.
Thank you, Barb. We're all happy that you are feeling well and you are with us today. You have had a tremendous journey to get to this point, and I don't think people realize how many years were in between your diagnosis.
22 years. Yeah,
22 years. So
and
it was not
I just turned 70 on Wednesday, and everybody was sending me cards going, you should have never made it to this age. This is incredible. And, it's true. I mean, we didn't think I'd make it to 50. I was so sick before that. So,
and here you are today.
That's right. Don't give up the fight,
70th
guys.
birthday week with us, and we are grateful and happy birthday to Barb. Daryl, we have left off where you have a similar story of liver cancer was kind of the turning point for you. So bring us from diagnosis with liver cancer until where we get to celebrate with you today.
All right. Well, I want to go. I want to go over something first before we get there, please. You mentioned a couple of times, I've heard the word stigma, and it's one of the things that kind of relates to my life. I want to say, first of all, I'm very proud to say that just a couple of months ago, or a few months ago, I celebrated 37 years of recovery from active drug addiction. And that was one of the things that I was fearful of when I found out that I had hepatitis C. My first question was, how do you get hepatitis C? And my doctor says, well, through blood transfusion. I said, well, I didn't use needle. I've never had a drug transfusion. And he says, well, you've said you're a recovering person. Did you use needles? And I said, well, no, I didn't use needles. I'm afraid of needles. And he says, well, did you roll up dollar bills or did you pass around straws? And okay, yeah, that caused it. And at that point, it was like, okay, we don't worry about how you got it. You have it now. What can you do about it? But I've been able to share that with some other people whose liver problems have been from addiction, whether it be alcohol or whether it be drugs. And just to know that you can get past that stigma is quite refreshing. And that was really, really refreshing for me to be able to get past that. So if anybody's listening for that. One of the other things that, as I was going through this, I lived in Florida, but I made a decision to move back to North Carolina. I'm originally from North Carolina, so I wanted to move back home, so to speak. I was closer to my friends. And when I moved back home, my uncle who raised me he was 92 years old, living alone. And lots of people thought he had dementia. Well, he didn't have dementia. He was just alone, and I said, gee, if I spent 22 hours alone by myself every day, I'd pretty much have dementia also. And at the same time, my mother just found out that she had lung cancer and pretty much knew we knew how that was going to end. So I didn't want either one of them to know that I was sick. while I was going through all of those things. And so mentally, that was very, very stressing. It was just really, really stressing, especially my mother. I didn't want her to know that I was sick. But again, we did get through that. And it's, I found out that I had liver cancer. We cured the liver cancer. And one of the things that I do today is I work with different organizations talking about the need for and the importance of organ and tissue donation. Because when my doctor sat me down to say, okay, you had liver cancer, but your liver is really bad, you really need a transplant, I had no idea what she was talking about. And here I was, I think I was in my mid-50s at the time. And I'm sure that I've changed my driver's license many times. I moved to many different states. And I'm sure somebody asked me along the way, would you like to be an organ donor? Went right across the top of my head. I didn't think about it. But at that time, I needed a transplant. But I knew nothing about it. And I said to her, you mean you could put somebody else's liver in me and I'll be all right? And she said, yeah, we can do that. And well, yeah, let's do that. I kind of like this thing called life. I'm having a pretty good time. So that's the one thing that I remember most. But that was the time when I really, really got sick as I started to go through that process. Because even though you say, yeah, I need a liver transplant, can I get a liver transplant? It's not automatic. That for me, the process of qualifying to get on the list was probably a year long. We're talking about physical examinations. We check everything from your head to your toe. We're talking about the mental capacity. What's your home like? Do you have the finances? Because for the rest of your life with a transplant, you're going to be taking medication. Do you have the resources to acquire that medication? So again, that process was about a year long. And I went through that, and it's a funny story now. It didn't make sense at the time, but the funny story was because I was going through the VA to get my transplant. My transplant was done at VCU, Virginia Commonwealth University, which is about 3 hours from where I live. So on this particular occasion, I'd gone to VCU for what I thought was an MRI. And my nurse coordinator says, I'm going to admit you to the hospital. And I argued with this lady for 20 minutes. I ain't got time to be in no hospital. I got to go. I got things to do. And when I think about it, the craziness of it was I couldn't walk from the entryway to her office. As soon as I got there, I had to put me in a wheelchair to push me around to go everywhere. And I remember I was doing something and somebody said, well, Daryl, what made you just want to say, I ain't got time to be in the hospital, I got to go? And I said, I think there's just something in us that just makes us just go until we can't go anymore, until it's just, that's it, I can't go. And I recall being at the transplant games in Birmingham, and I heard somebody say, man, you transplant people, you just won't quit. You just go forever, don't you? And I think that's very true. But she did convince me that I needed to be in the hospital when she said, you don't understand how sick you are. I need to be able to monitor you 24 hours a day. That kind of got my attention. And I did get my transplant 3 days later, but it wasn't all over then, Morgan, as you know. During the surgery for my liver transplant, my kidneys shut down and didn't come. So I spent 19 tough, hard months on dialysis. Dialysis is probably, I don't wish that on my worst enemy. Dialysis was very difficult for me. And one of the things that made it so difficult was during the liver transplant surgery, I lost 50 pounds. I went in at 180 pounds. I came out of surgery at 130 pounds. And that just really just freaked me out, man. I mean, just like, oh my God, I got to get my weight back. So I'm eating everything. and which dialysis kind of works along with your weight. As soon as you get there, you have to weigh in. And let's say hypothetically, your weight is 150 pounds. So everything over 150, that means that's fluid that's got to come off of you. And so I'm eating, I'm gaining weight, but at the center, the dialysis center, they didn't see it like that. No, your weight is this. So I was going through some hard times in dialysis. There were times when I would be dehydrated because of taking too much fluid off. And so when I got the kidney transplant 19 months later, you know, the quality of my life improved 1000%. And so here I am now. I just actually full of life. I love the idea of being alive, and I love the idea of telling everybody about what transplant did for my life.
And we are grateful that you are here, Daryl, and we are grateful for Barb and yourself sharing all aspects of your journey. I think so oftentimes we hear about the ending, the happy ending, and hearing that hard piece in the middle can be so empowering to others who are in that middle piece where you don't know what tomorrow brings and you maybe don't know how to take that next step forward. Kimberly, we had a few questions kind of going in the chat as everyone's been speaking, and I would like to bring some of them to you, and they may not be questions that you can answer right now, and that's also okay as well. I do want to be really mindful of time, so we can leave a little bit at the end here for people to share their stories. I do want to ask these, though, briefly. One person did ask Barb and Daryl, this is actually directed at you, if you are okay sharing this information. If not, we understand. Someone asked, how old were you each when you received your transplant? Someone is concerned that maybe they'll be too old when it's their time.
I was 65.
I was 59.
Thank you.
And you can check with your hospital because the different hospitals have different limits, but it's usually like 70 or higher. So, you know, if you're younger, don't worry about it.
Kimberly, someone had mentioned that they will be 61 coming up in the following year and that their son has previously had a liver transplant. If their current transplant fails, can he have his liver? And I know that this is a much more drawn out question and not as simple as that, but if you could just kind of give a brief overview about what that process looks like.
Their process looks like, you know, talking with, of course, a hepatologist, talking to them about what their current status is, and then they may, depending on what the hepatologist, of course, outcome is in their exam, they may refer them to an outpatient liver transplant clinic like ours here in Philadelphia, where they would be assessed to determine their eligibility. And that looks like an assessment from head to toe. We do the psychosocial comprehensive assessment. We talk about supports. We talk about, like Mr. Darryl said, their financial status, their housing stability, and then they will continue to go on through that medical examination where there will be, you know, plenty of tests, plenty of scans, and then there is a committee that helps bring all of their information together. It's social work, it's pharmacy, it's nutrition, it's the hepatologists, it's social workers that all bring all the information that they've gathered on that patient together to determine what the next step is for that patient.
Thank you.
That process can take from start when they come in to have that outpatient assessment done. It could take anywhere from then, like Mr. Darryl said, it could take up to a year depending on how many tests, you know, that they need to take. And it can take a little bit beyond if they need addiction, you know, counseling that takes, you know, at least 3 months or so. So it could take possibly about a year, a little over a year for them to complete that process.
Thank you, Kimberly. Another question that I want to address really briefly. Someone asked, how ill does someone need to be in order to receive palliative care? And again, I know this will be institution specific, but just sort of a broad overview on what does that look like kind of with new guidelines?
For patients, of course, like you said, it depends on the patient, but usually that determination is done probably with their hepatologist, who would determine that that patient is at the critical point where they could use palliative care to continue to help them with managing their symptoms at home. There's in-home palliative care that can help patients. And we've also had patients in palliative care, but still attached to our transplant team, and we continue to monitor them, closely, simultaneously working with that palliative care team, just to see like what their progress is and kind of how we can continue to help not only the patient, but also the palliative care team with the patient's care.
Thank you. We are going to open the floor here in just a moment for everyone to have a minute to sort of share if you want to. But before we do that and we lose everyone, we want to make sure that we are leaving enough time for everyone. We do want to just say a quick thank you. If you are looking for any additional information after today's program, we do encourage you to visit us at liverfoundation.org. You can find more details about our virtual as well as online support groups, which you might have seen a few of those links in the chat as well. We also do have additional patient support services that you will be able to find the links to, including our helpline. We also do want you to come and connect with us on social media. We know a lot of people are on there nowadays. You can find us on Facebook. We have Instagram, LinkedIn, X, which is formerly known as Twitter, as well as our incredible educational lineup on our YouTube channel. If you need any help finding these links, all of you should have my email address from when you registered. Please do not hesitate to reach out. I am more than happy to send those over as needed. So I do want to go ahead and allot some of this time now. If people would like to kind of come off mute, we encourage you to have your camera on if possible. But if you have questions for any of us, or if you want to share a little bit about your journey, I know we saw a few of those conversations starting in the chat, but we would love to hear from you if anyone feels comfortable.
I just want to share a little bit about, so I was diagnosed in 2020 with, at that time, it was NASH. And I was fortunate that I had really good health coverage that covered mental health services, because I really, really relied on those. And Barb, I just want to say you are an incredible inspiration. Your story and just the years that you suffered, and you just seem so positive. I just find that incredible, because my journey only lasted 5 years before I'm 27 months post-transplant.
Okay.
But I know that, especially at the beginning of my journey, I needed mental health services, and my health coverage covered that, and I took advantage of that. And also the thing I want to mention, and one of the reasons why I needed it, because I was kind of like Daryl. I was living a really good life when I got diagnosed. I've been in the wine business for 45 years. I was in sales. I entertained quite a bit. I drank really great bottles of wine and ate really good meals in really fancy restaurants. And so when I got diagnosed, I started to go down the rabbit hole of shame, because I thought my lifestyle contributed to, and it may have, I don't know that, but I went down that rabbit hole and began to blame myself for my disease. So when I was diagnosed with stage 3 fibrosis. So I knew I was going to eventually have to have a liver transplant. So by the time I got diagnosed, I knew it was too late. And so there's nothing I could do to reverse it. And so the word cirrhosis carries so much stigma that I was embarrassed to tell people that I was suffering from cirrhosis, because they knew I was in the wine business. So they automatically assumed that my lifestyle was a reason why I had liver disease. And so I really had to overcome that. I really had to deal with that. And then of course, as soon as I got diagnosed, I had to give up alcohol. And that was a big part of my life. I mean, I did this for 45 years, traveled the world, lived a great lifestyle, and I really had to grieve the loss of that part of my life. And I had to deal with that. So I can't emphasize enough, support systems, my faith community, family. I have an incredible support system in my wife, my children, friends, family, and don't be afraid to get to seek mental health services, because it really made the difference in dealing with my diagnosis and dealing with the wait for a liver. So,
and try to find something else that you can enjoy after.
oh
Your life certainly doesn't end, you know. And
no,
I was never much of a drinker, so I was lucky with that. But I told my doctor, tell me I can't have M&Ms and Diet Dr. Pepper. We're gonna have a problem, you know. So
I stopped. I knew drinking. I knew that was out of the question, and I was able to do it. It was hard. I'm not gonna lie. I still miss it. I do. I have a wine cellar, and I have a lot of great bottles of wine I know I'm never going to be able to drink. But fortunately, I got friends and family who love wine, and so I don't mind sharing it. And so it's just, I just had to deal with that, and I'm okay, and I'm thriving. I'm not just healthy, but I'm thriving. And I'm an advocate for ALF. I'm also working with a local organ procurement group that's, so I'm really trying to live a grateful life. I retired in the middle of all this because when something like this happens to you, it really kind of changes your perspective on life. You begin to reprioritize, and money no longer became important to me, but time and in trying to give back to the liver community that was really so good to me. And so I'm just grateful. I really am. So
Well, thank you, Manny, for feeling comfortable to come and share your story. I know that your story resonates with so many on this call as well. And while everyone does have their own unique story, so many journeys intersect with each other, because this is such a powerful time to share what your experiences were, and not knowing, as many of you have mentioned, how that sharing might impact someone else and where they are right now with their journey. So with that, I encourage, if anyone else would like to come off and just share anything or ask any questions, please take the time to do so. If no one feels comfortable, that's okay too. We don't want to put anyone on the spot at all. Okay, well, as we wrap up, I would love for Barb, Daryl, and Kimberly to just share one piece of advice that everyone can take home with them today. And this can be something that you wish you had told yourself during your journey. This can be something you wish to say to your future self. You choose, but what is something that you want to be able to share with people that you would also want to share with yourself?
For me, I'll just say, if you know anybody who has been through this, definitely talk to them. I was so fortunate that somebody I had known since I was 4 years old had a transplant. And so when I went in the hospital, I knew what to expect, and it wasn't nearly as scary. And literally, as soon as I woke up, I said, I will help people get through transplants. I will never make someone else go through this, without knowing what to expect. So educate yourself. Just be careful with Google. They make it sound like you're going to die in the hospital. You're going to be so uncomfortable. And I got to say, it wasn't nearly as bad as I expected it to be.
Thank you, Barb.
I want to agree with Barb there. Not knowing anything. As I said, when my doctor said to me, liver transplant, I had no idea what she was talking about. I really put my faith and my belief in my doctors. I believed them. I took their professionalism very serious. And that's what got me through it, because I had no idea what I was walking into. And one of the sayings that I had that I still use today is, keep your spirits high and your faith strong. And no matter what it is, I think that gets you through life.
Prayers got me through my stuff. My friends, it's, they've been unbelievable with prayers. So
thank you. Kimberly?
Morgan, I have to ditto both Miss Barbara and Mr. Daryl. And I would definitely, encourage all patients to keep in contact with their hepatologist, keep in contact with their transplant team, always call and, keep in contact, keep lines of communication open with their social worker. We are the avenue into their team. So if they have any questions, any concerns, any changes that they see in themselves, we take that information, we share it with the team so that they can, be contacted and given any recommendations. So always keep that positive outlook. It takes patients a very long way. Keep your supports close so that they can advocate on your behalf throughout the journey.
Thank you. And thank you to all of our patients today who have been here with us, and caregivers, medical professionals, industry partners. We appreciate everyone who is with us. Again, if you have questions, please visit liverfoundation.org. All of you do have my email address from the registration if you need access to any links, as our webpage is quite robust and can be challenging at times to navigate. Please do not hesitate to reach out, and I hope everyone has a wonderful weekend. Thank you all.